Today, I will talk a little bit about cancer in general. Now, I'm not an oncologist by training, so what I will cover today is a very broad and general discussion of the topic. So, what is cancer? Basically, cancer is your cells that are growing out of control. Many of our cells normally have the ability to divide and multiply. If you think about it, that is our wounds normally heal as an example. Normally, our cells know their boundaries and know when to stop growing. In the example of a skin wound, once the gap has been filled, the cells would stop multiplying. So how does cancer develop? Basic concept is that a cell develops a way to overcome the limit or control mechanism and continues to grow and multiply without any checks and balances. As you may already know, DNA or genetic coding is a major factor in how a cell behaves. So to understand how cancer develops, we have to talk a little bit about the DNA and molecular biology. The basic idea is that when a cell multiplies, it tries its best to make the exact DNA or genetic copy. But this mechanism is not perfect, and it makes a mistake every so often when it tries to replicate its DNA. Cells have mechanisms in place where it tries to recognize the mistakes and tries to correct the error the best it can. In extreme cases, if the cell recognizes that a fatal mistake has been made, then it can't even tag itself or flag itself so that our defense immune system can come and kill the cell with errors. A cell's repair mechanism is not perfect, however, and some mistakes pass undetected and unfixed. A lot of times, this mistake is inconsequential. Imagine you're typing and copying a book. You may make a mistake typing some letters, but most of the time it will not take away from the main message of the book's content. So most of the time, the readers will recognize these mistakes as typos without misunderstanding the message of the book. Rarely, however, some mistakes can be made that actually matter and alter the cell's behavior. In our example with copying a book, imagine you are trying to copy a script that says 50%, but by mistake you write 0.50%. You can see how that is a simple mistake made by just a period, but it can significantly change the meaning of the sentence. One of these rare mistakes that matter can lead the cell to start multiplying uncontrollably. Keeping in mind what we just talked about, now you can easily understand what things can increase the risk of developing cancer. Things that directly cause damage or mistakes in our DNA or genes could do this. For example, UV sunlight can directly cause mistakes in our DNA. And all the things that you hear about oxidants, free radicals, and how smoking is bad for you would all fall under this category. Theoretically, if something causes our cells to replicate more often than normally, this would also increase the risk of making more mistakes. In our example of copying a book, you can imagine that you would make more mistakes the more times you have to make copies of the book. If you eat types of food that stresses and damages stomach lining cells more often than other people, your stomach cells will have to replicate more often than other people, and the chance of your cells making a mistake will be higher. So how does genetics play into increasing the risk? To put it simply, you can think of it like this. Every cell has both activation and deactivation code for replication in the DNA to use depending on situation. So every cell is born with acceleration gas pedal and brake pedal. But genetically, some people may be born with enhanced gas pedal or faulty brake pedal. An enhanced gas pedal may or may not immediately result in a cancer cell, however. If this enhancement is not strong enough, normal brake pedal may still keep the cell under control. So this particular cell may not turn into cancer until another mistake is made to render a faulty brake pedal as well. Similarly, if a cell is born with faulty brake pedal, it still may not turn into cancer cell until another mistake creates enhanced gas pedal or another mistake takes out the brake pedal completely. So normal checks and balance system would allow cells to withstand some degree of mistake. But those with family history or genetic risk factors often can be thought of as inherently starting with faulty brake or enhanced gas pedal, so they have less tolerance to withstand mistakes. How is cancer typically diagnosed? Obviously, the first step is usually the patient himself or herself noticing the symptoms that something is not right. Second step would usually be a clinician seeing the patient at the office or emergency room. Cancers at visible locations like skin cancers or tongue cancers may be fairly obvious already at this stage sometimes. Third step usually would involve medical imaging, whether it be X-ray, ultrasound, CT, or MRI, or etc. Generally, imaging of some kind is typically necessary to diagnose any cancer that is not visible at the skin surface level. Even for visible cancer like skin cancer, often imaging is still needed to assess the degree of the problem. Once the abnormal spots are identified with images, the next step usually is the biopsy, where they attempt to take a small sample, often without large surgery. This way, pathologists can study these samples to diagnose what type of cancer cells these are. Depending on the situation, after diagnosing what type of cancer it is, some additional imaging may also need to be performed for staging. Staging for different types of cancers are different, and oncologists would know best how to explain this in detail. But the basic idea revolves around two main things. First, locally, how big is the cancer? Also, is it invading and damaging things next to it? Second, has it metastasized? In other words, has it spread to lymph nodes or distant parts of the body? This is generally a bad sign because this means that cancer cells grew and found a way to travel distance. Often it means that it got access to either lymph system or bloodstream. This way, the cancer cell didn't just grow contained in one location, but it has access to these roads to spread to anywhere lymph or blood is flowing. This can be tricky because even if someone has only one metastasis identified, who is to say that tiny cancer cells have not spread elsewhere and are just too tiny to be detected with current medical technology? Because knowing that there is even one distant metastasis tells us that the cancer has access to these roads to spread to multiple places. Now, cancer treatment is not my area of expertise, and so I will just share my very basic and general understanding of some treatments. One obvious option is surgery. I can think of two possible reasons for the surgery. First, if the cancer has not spread anywhere distant, and if the cancer is not too large and well contained in a single location, surgery can be considered in an attempt to cure and completely rid of the cancer from the patient. If the cancer was found early, this would be great. Surgery can also be considered not to cure, but as a symptom control. For example, cancer may have already spread to multiple locations, but one of the tumor locations may be right next to nerves and may be squeezing the nerves. In cases like this, surgery can be considered to alleviate symptoms that may be debilitating. Traditional chemotherapy is a drug therapy. My understanding is that these drugs do not typically target cancer cells specifically. Rather, these drugs are meant to be toxic to any cells that are growing or multiplying rapidly. So normal cells that normally do not replicate much would only suffer little damage. On the contrary, cancer cells, which tend to be always replicating and growing, will be suffering more damage from these drugs. Since these drugs attack any cells that replicate a lot, our cells that normally replicate and grow fast would also be affected, unfortunately. Hence the damage to hair cells and stomach lining, for example, resulting in hair loss and stomach issue and nausea and etc. Radiation therapy can be thought of simply as shooting a laser beam of energy to damage the cancer cells. If the cancer cells are few in number and small in size, beams can be engineered to focus the attack on a small local region right at the cancer site, minimizing damage to local normal cells in the nearby region. If there are too many cancer sites spread over a region, however, they may have to shoot the beam of energy equally over a general area, like a shotgun approach. For example, they may just have to shoot a large beam of energy through the entire brain. Cells that grow or replicate fast, like cancer, are certainly more prone to damage from radiation therapy, but in this case, normal cells within the field of treatment would also be exposed to the same degree of radiation. Targeted therapy is often a drug therapy, but unlike the traditional chemotherapy, this therapy tries to target a specific marker or characteristic of the cancer so that the drug avoids damaging our normal cells. For this, they would typically run tests on the cancer sample to see if there is any marker that we can target with currently available drugs. With people living longer and longer lives, many of us unfortunately would probably have already or will have met someone in our lives with the diagnosis of cancer, whether it be self or family member or a close friend. For those of you who are going through such time, I wish the best for you and your family and your friends.